Hey folks, this is Ray Kober. If you haven't done so already, please click that subscribe button below. That'll help us get better guests and make the show better for you. So once again, click that subscribe button, join us for this journey, and together, let's make healthcare better for everyone.
Get ready to take control of your healthcare. Here's your host, Ray Kober.
And we're live, ladies and gentlemen. Welcome to Broken Healthcare. My name is Ray Kober. I am your host, and we are coming to you from the Ascend Conference, the 10th anniversary of Ascend, and I'm here with Trace Voshell of GoGoMeds. What's going on, Trace?
Not much, Ray. I appreciate you having me, man. I'm
Dude,
excited to be here.
So, we had a couple of conversations on the phone, or at least one conversation on the phone, and you have a very interesting background. I mean, first of all, look at this fucking guy. He's jacked. He's totally ripped. And I asked you, I said, how could I look like you, bro?
Well, you could have got up this morning and come to CrossFit with me. I'm a CrossFit addict, playing baseball my whole life, and then I got into CrossFit, working out and mountain hunting and everything else. So I like to lift heavy things and see what I can do with my body, I guess is what it comes down to.
Right on. So that's like part of your routine. Like you legit wake up. What's like, I know there's West Coast. So East Coast, what time are you up normally?
East Coast, I'm up about right before 5 a.m., do a little bit of reading, go to our 6 a.m. CrossFit class, get my kids ready for the day with my wife, get them to school, work, and then come home and play wiffle ball in the yard and do whatever else they want to do. So try to get the work in early.
So this doesn't happen all by itself.
It doesn't happen all by itself. No, I've got to walk past quite a bit of desserts and treats at the office and try to stay a little bit self-disciplined there.
Well, you know what, dude? It's interesting because, we talk about the broken healthcare system, and I think a big piece of it is exactly, the life that you're living is exemplary of the way that we all should kind of think about. If listen, like, there's something to be said for, drinking and partying hard and running, like full tilt.
Yeah.
But you pay a price for that,
you do.
Down the road.
You pay a price for it. And, one thing I found, especially at these conferences, is everyone and their brother has a happy hour, and you can only go to so many, right? So with us being in an industry that's focused on healthcare, I was like, well, why don't I do something that's a little bit different, get people their workout in? So I started paying for these workouts for people to come with me and network in a way that they'll remember, hopefully, instead of drinking too much and maybe forgetting a little bit.
Yeah.
But I also kind of relate it to going to a GNC, right? Like if I'm going to go to GNC and pick up a protein or work on something that's health related, I want to talk to someone who looks the part if they're going to give me advice.
Yeah.
So at the end of the day, too, I kind of put that stock into it to say, I want to have people have trust in me about the way I'm taking care of myself and going about my business when it comes to healthcare, too. So that's just an important piece of my life, I think.
Yeah, man, that is so cool. I so admire that. And, I've been like on this yo-yo ride. So There are points, and not as many as I'd like, when I'm feeling ripped and fit.
Yeah.
And then there's, kind of, I'm in the in-between phase right now, and then I've been heavier than I am, but I look at myself and I say, you know what, you're your own worst enemy, because
100%.
it's within my control. I mean, knock on wood, I don't have like a physical disability. I'm able-bodied. There's nothing preventing me from setting an early alarm and getting up and putting the reps in and putting the work in. And I think the other big piece of it, though, the workout regimen, I want to hear more about that, but that's kind of a chunk. But I think the bigger piece of it is diet and what you're putting into your body. So tell me a little bit about that.
And that's the hardest part, right? I mean, we walk by a fridge. Like, we live in a comfortable society where there's always food available.
Yeah.
There's always a cookie to walk by. Or, gosh, we saw the spread out here. So it's just like, well, what is that mouth pleasure like worth to me?
Yeah.
And don't get me wrong, I love a Blizzard from Dairy Queen. Ask my wife. I probably spend too much.
You got
on
a sweet
DoorDash.
tooth, don't
I've got
you,
a
Trace?
sweet tooth, man, and it's
Cookies and Blizzards.
Oh my goodness.
We got the key to Trace's heart.
100%. Yeah, I'm guilty for sure.
Right.
But I mean, it all comes down to mental, right? So like what can you endure and what's it worth to you?
Yeah.
And I think that's why I fell in love with CrossFit too, is because most of it is not really about your physical ability. You grow into that, but it's about, will you turn that switch off in your mind and stop listening to say, I'm going to quit or I have to quit.
Right.
And just be like, no, I'm going to push through because I can do anything hard for 10 minutes. Like it's 10 minutes of my life. It's going to be hard. And going into sales, you're in sales too. Like, are you going to quit when you hear no? Well, if you do, you're not going to do a very good job at what you're supposed to be doing. So I think that relates to CrossFit too. So I kind of challenge myself in everything in life. I think at the end of the day, I'm a glutton for punishment.
Well, but it started. Talk to me about like your early years. So I'm sure that I don't know what your family background is. If mom or dad or family support guided you towards sports. I think you mentioned that baseball is kind of a thing in your family. Tell me a little bit about. And you didn't just like make the high school team. You went a little further than that.
I was lucky to, yeah. So baseball is a huge family thing for me. So my great-grandfather played up to AAA with the St. Louis Cardinals. He actually played with Stan Musial, so we've got some pictures of them in the All-Star games together. Both my cousins played college and professional baseball. One was drafted out of high school, and then I got to play 4 years of college baseball, went undrafted, and I played a little bit of bus league baseball. I'd toe the line of saying I was a professional because my checks were so small. And then my little brother played college baseball too, so it's a family lineage for sure. My twin boys are now playing baseball, which is so much fun for me to watch. But no, my parents led me to it. I think it's just being an athletic family. It was kind of natural. It wasn't really a push towards it. My dad always told me that, even though our family loved it, if I didn't want to do it, he was never going to make me. And I feel the same way about my boys. So I think just having that natural guidance toward the game and then loving to work hard got me into baseball, and then, sales and CrossFit and hunting and being in the mountains or whatever the case is.
Well, talk to me about that a little bit, because I saw you you had a picture on LinkedIn. I think you were shooting a bow.
Yeah.
How'd you get into bow hunting?
My dad.
Your dad?
Yeah, as I say, also baseball and hunting are two big things in my family. My dad, I can't even count his accolades anymore. He's won Shooter of the Year in national and world championships in his class 6, 7, 8, 9 times now. I can't keep up with the old man. But it's just another mental challenge, right? When you're at full draw, you can't think of anything else besides that shot. It's the same with working out, whatever the case is. So I like that challenge of it. I like seeing how close I can get to an animal, like what I can put in the freezer for my family. That's a big part of our diet is, we eat what I kill. There's nothing more natural than that. No, you can't get it at Whole Foods.
Wait, where are you from again?
I say Cincinnati, Ohio, because if I said where I was really from, no one would ever know. I'm from a small town called Owensville. So I went to high school. I think my graduating class was right at 100 maybe, and that counts the trade school kids that came in to walk.
And so you got a lot of wild game in where you live?
Yeah, big whitetail population, wild turkey, and then after baseball, I started going west and doing some elk hunting. I'm hoping to get on an antelope hunt this year, do a bunch of stuff like that. I've gone bear hunting, a couple of those things.
Wow.
Yeah.
Crazy. I hear bear hunting is like you're in a war zone.
It's different. It's scary how quiet they are, man. Like, I turn my head and there's nothing. You turn your head and there's a 300-pound bear, and you're like, where did you come from? So it's wild. Yeah.
Wow. And so I know Joe Rogan talks about, there are different, I guess, pull strengths, or I don't know, how do you describe it? Yeah.
Yep. Draw weights.
What's your draw weight?
I set mine at about between 72 and 75, which doesn't sound like a lot, but it's a different muscle group for sure.
Yeah.
So if you get into a target course and you're shooting 30 targets, you're going to be sore at the end of it if you don't do it consistently. So that's plenty enough to hunt an elk or anything like that. My wife's killed deer with her bow, and her draw weight at the time was probably about 40, 42. But 70 gets the job done. And then most of it comes down to your arrow weights, what you're putting out front, your grains on your front weight and everything like that.
Is it difficult? Like if I wanted to take it up as a hobby and target shoot, I'm not much of a hunter, but if I wanted to target shoot, what would you say like the degree of difficulty is? How quick could someone that's never done it before pick it up?
You can pick it up if you're willing to learn.
Yeah.
And you're willing to buy the right tools. A lot of people jump into a finger trigger and start slamming the button so they're controlling the shot. The best way to learn how to shoot a bow is to lose your own control. So you'll actually buy a release to where when you're at full draw, you just keep pulling and pushing and the shot's a surprise. Because what you're doing is taking that control out of the shot to say, I should shoot now because my pin's there. And saying, okay, focus on the entire process. Now push and pull, bam, the shot goes off and your brain takes over and the arrow goes there. So that little bit of loss of control is actually the best way to do it. I've brought a lot of guys into starting to shoot bows, and if they do it that way, they're successful quick. But if they do it the finger route and just start slamming a button, it's just like, man, I'm all over the place.
Right.
Well, you're trying to control everything instead of letting go of it and just let the process take over.
Right. Very cool. It sounds like there's a whole, it's like another rabbit hole that you got to go down. It's a whole universe.
It's just like a golf swing, right? I'm an awful golfer. I have a baseball swing. If we go to Top Golf, I'm hitting towards the left net and I'm hitting the right, and I can't fix it. But it's the same thing, is how dedicated to it can you be and listen to someone else.
Gotcha. So tell me a little bit. You got a very interesting background. I mean, with athletics and hunting and, just that being a part of your life, a big part of your life, family.
Yeah.
How'd you get in this racket? And tell me.
I don't know. Yeah, that's a good question.
What'd you do before GoGoMeds?
Yeah. So I guess it all comes down to baseball ending. So at the time, I was lucky. I finished my degree. Finished my degree and my internships at Ohio University, went and played my baseball, and then when it ended, my girlfriend at the time, who's my wife now, was back in Cleveland where she was from, and then I went back home to Cincinnati, and we were trying to figure it all out, and we just decided to say, hey, whoever gets the best job first kind of wins, and that's where we'll move. And I got hired by Humana. So I jumped into Humana. I spent 11 years there. I got hired as a patient care coordinator. So I went from playing ball in front of a couple thousand people to sitting in a call center and answering phone calls. So when you ask me how I got there, I really don't know. But sitting on the phone, that's how I learned pharmacy, honestly. I started learning drug names, what they were treating, working with patients directly, working with the physicians to get approvals, working with the insurance company, working with patient assistance programs. So you really cut your teeth there if you're willing to, again, just listen and learn. But at the same time, it was eating me up to sit in a chair for 10 hours a day. Like, I'm an active person. I don't want to be doing that. So I was lucky enough to find a small sales team within at the time. There's 3 or 4 of them that were covering the whole country, and I just approached them and said, hey, I want to be a part of this if you're ready to grow. And luckily at the time, the girl who was in Ohio was ready to move to Florida and open that market, and I got to take over Ohio, Indiana, and Kentucky. Fast forward a few years, I was doing national sales training, helping grow the team. Then, I was a regional manager, and then by the time I left, I was the director of oncology, and I was probably part of at least 90% of the interviews to hire the rest of that team. So when I started, there was 4 of us. When I left, it was a team of about 80, including an oncology division and inside sales. I love my time at Humana. I like what I'm doing a lot now. What I'm doing now a whole lot better because there's more disruption here. But when I left, it was mainly just because I knew my ceiling. If you're not a pharmacist there, you get capped off, and I said, well, it's time to do something different. GoGoMeds knocked on the door, and the rest is kind of history.
You didn't want to go get your PharmD?
I didn't want to. I'm not smart enough. I know my limitations.
Yeah.
There's a lot smarter people out there, but I like to sell things that I believe in.
Well, I think you sell yourself short. You don't strike me as someone that's not smart. It's
No.
just, it's a matter of what has your interest and,
the chemicals and everything else are not. But, well, when I was in college, I went originally to be a teacher, and then I realized that I wanted to make a little bit more money, and I wanted to coach baseball. I think that's really why I wanted to be a teacher. So I went to my guidance counselor, and I was like, well, what about dietetics? Because I got into the working out. And she's like, how are you with math and science? I'm like, awful. She's like, don't do it. She said, you're going to make as much as a teacher, and you're probably going to fail your courses and not be able to play baseball. So we chose healthcare administration.
Right on. That sounds like a pretty healthy choice.
Yeah.
No pun intended.
Yeah.
All right, so you make a transition. You go from Humana now to GoGoMeds.
Yeah.
And did you know about GoGoMeds? Did you answer an ad, or
No.
How did you fall into that?
Recruiter.
Recruiter.
Actually, yeah, they reached out to me. I knew I was looking for something different at the time, so it was just right place, right time. Jokingly, my wife and I still talk about it. When I took that leap, I knew it was a good opportunity. I didn't know what I was going to be doing. I couldn't explain it to her. So thank goodness I'm a quick study.
It's a bad sign.
I'm a quick study. So when I jumped on, they're like, hey, here's what we do. And GoGoMeds came up in the telemedicine space. And when I say that, think of lifestyle medications. So like if you look at companies like Hims and Hers or Rose, the guys that you see commercials for on TV.
Yeah.
We set up all of their back office, like their pharmacy fulfillment and all the white labeling. So when it goes out to the patient, it's pretty in the box. They get their prescription, all of that. So that's where they came up. When we started to see everything with the PBMs overpricing on drugs, that's when they looked at what we were procuring generics for, and we're like, we could be a solution and actually help with this problem. Did they know how was why they kind of reached out to me and said, hey, we need a true sales team now to get into this market, and we think you can help us. So that's where they kind of recruited me. And that's where I jumped in to say, okay, well, how do we figure this out? In the process, with my background, I also gave them the idea of starting to work with direct primary care and concierge medicine groups, just because I knew how quickly that was growing. In my past of working with physicians, it ended up being a good fit too. So we actually work in that space also.
Yeah, no, and I couldn't agree with you more. The DPC space, I believe, is the key to healthcare reform.
Yeah.
Let me clarify that. I'm really encouraged by the DPC movement. I've said it before on the show. I think that getting back to a place where the physician is got a relationship with the patient.
Right.
They're not beholden to, they're not a slave to the healthcare system
Yes.
that owns them, and they can refer when referring is appropriate, but they could handle much of the stuff in-house. So how is that vertical going for you? It's interesting because I joke with doctors. I interviewed plenty of doctors, and I tell them, look, don't take this the wrong way, but doctors are really good at medicine and pretty shitty business.
Yeah.
And they kind of laugh, and they're like, yeah, we don't have any training in it.
Right, yeah.
Some of them are very good.
That's true.
They like learn, like, hey, I got to learn this stuff. Others, they delegate, and they're like, hey, I want to take care of patients, people.
Yeah.
That's really why I got involved. How is Broken Healthcare Podcast is brought to you by Benefixa Healthcare Consultants. Visit benefixa.com to learn what's possible. Reduce the cost of healthcare for your organization, deliver better outcomes for your people, and yes, design health plans that give your people a path to $0 out-of-pocket costs for healthcare. Visit benefixa.com. How is that vertical going for you? Is it growing?
It is. It's growing. So what I knew about the space was just what you said. These physicians are leaving large hospital systems, leaving universities to get back to actual patient care and spending time in the room with their patient, giving them the care they deserve and what they went to school for. They didn't go to school for paperwork and everything else. So what I knew about that was when they left these centers, they also lost that pharmacy downstairs. So they've been reduced to either A, setting up a small in-house pharmacy with a small formulary that then they had to manage, hire people for, manage manufacturer relationships, the list goes on. Or they could send it to your local network of pharmacies, your CVS, your Walgreens, your whoever's, and hope that they had the medication, hope that the patient was going to pick it up. Because we have a digital aspect, I've started to approach them and say, hey, we can build this for you to where you just link it into your website, create your own formulary, and you can offer prescriptions that are white labeled now. We'll even put their logo on it out the door, so when their patient gets it, it's part of that, concierge, that white glove touch. And you guys kind of set the pricing. So it's competitive, it's right by your patient, that it's going to get ordered and sent to their door, and it creates a new revenue stream for them because it's all cash pay. So there's no insurance involved, there's no adjudication or going against Medicare, whatever the case is. And they've loved it. They don't have to manage anything. It's just saying, okay, well, I'm going to set my formulary. I'm going to ask my patients if it's something that they want, and if so, I'll send them, to GoGoMeds, and it's white labeled as their name. Or if not, then they go to their standard pharmacy and they pay their insurance rate, and that's fine. But it's been a great option, and it's starting to take off really quickly. We're working with a group right now that's going to go into launch who has about 80 locations across the country, growing into over 100 by the end of the year. So that's exciting for us and exciting for them. But yeah, we're excited by that opportunity too.
So when you say you're white labeling it for the DPC practice?
Yeah, so if you went to their website, it would say, order my product here, or, new pharmacy, and you would click on it and it would be all of their branding. So
you create like a portal,
yeah,
specifically for
it
drugs.
It would be like a pharmacy landing page where you go in, they could price shop it, type in the name of the drug, here's the price, click order to cart. If the prescription already beat it, it'd be waiting for them, and if not, it would prompt the doctor to send that prescription and get linked up and go out the door.
And so, Trace, just so I understand, the audience understands, is this for all things drugs, or is it a microcosm of drugs? Is it an end-all, be-all, or is there got to be some kind of a backstop involved for specialty meds like Humira, stuff like that?
Good question. So at GoGoMeds, we focus heavily on generic medications. We have access to all of the brands, even the GLP-1s and things of that nature. Our sweet spot is generic medications. So we can always open our entire book and let the physician or the employer group see it and make their decision. Most of the time, it is very geared towards our generic book because that's what we order the most, so we have the most buying power there. Mm-hmm. So especially when it comes to a specialty product, in my background, most of the time there's going to be some patient assistance needed or a new solution like some of the people that are here this week. So we kind of cap there and focus on the generics where people are ordering 5, 6, 7 drugs at a time because most people on one generic are on a handful, and that's our sweet spot.
Interesting. And so just trying to still wrap my head around it. So if I'm a DPC provider and, it actually just happened. I'm in the process of finding a DPC provider. I think I have one nailed down. Okay. In New York, it's very tough because regulations and rules in New York, Massachusetts, 2 of the worst states. California might be a close third.
Usually.
Right? And it's tough. It's tough for a doctor to hang out a shingle and say, "Hey, I'm in business." They make it very difficult.
Yeah.
So I think I had an interview with a doc that I think I'm going to call my primary care physician. And the reason that I'm doing this is up until now I've gotten my health care through my wife, who's a speech language pathologist. She works with preschoolers. You know, she does God's work, I say, Trace. You know, she's working with developmentally challenged kids, autism, feeding disorders, really the kids in their infancy, so 2-3-year-olds who intervention at that period of their lives is everything.
Yeah.
And she steps up to the plate every day and delivers.
God bless her.
Really.
That's awesome.
So she actually, we get our health care through her preschool to United Healthcare. And doing what I do, I'm like, what am I, a fucking hypocrite? Like,
It's a tough one to swallow.
I got to get off this train. So her health care just renewed, and I said, take me off. I want to venture out. I'm going to go to faith-based healthcare. So I signed up with Zion Health Share, and they're kind of my backstop.
Okay.
And now I'm getting a primary care physician. And the reason that I'm doing it is I really became frustrated with the system. First of all, I'm completely disenfranchised with just how things are going. You're basically a cog in the wheel. They run you through the ringer. And your DPC in a traditional healthcare model, your primary care physician, they're going to refer you to within their health system. You're going to pay the most that you can possibly pay, and you're not assured. I mean, although I think my doctor, behaves with my best interest at heart, and I think that's true of most docs. They're under a tremendous amount of pressure to write and prescribe, and just tests. And they're paid. They're glorified salespeople. They earn RVUs, relative value units, and the more revenue they drive in their health system, the better it is for them. And I'm sorry, I hate to be a cynic, but that's just the business of the game, right? So I said, let me break away from this, and this month I'm actually going to schedule a meeting with the direct primary care doc. So I go to him now and I say, okay, I have no insurance. Although I do think there is a pharma piece to the Zion Health Share. I want to introduce you to my friend Trace. He's with GoGoMeds. They may be able to help you if you don't already have a pharmacy solution in place.
Yeah.
Would that be a good icebreaker? And then what would he have to understand about kind of where your services begin and where they end? And because putting my kind of healthcare advisor cap on, I don't feel like it's ever my position to tell my client, do this or do that. But it 100% is my obligation for me to be on my A game and tell them where there might be holes or exposure. And I think that's really important. So what type of exposure how would your conversation go with a new doc?
Yeah, and most of the time it's, hey, what are you treating, right? Like, what are you commonly treating? What are you referring out? Like, how much are you kicking out to a specialist if it comes to a Humira or, Skyrizi's or anything like that? Are you kicking those out? But most of the time it's just like, hey, bread and butter, if you're seeing patients that are on non-acute therapies, because I tell everyone all the time, don't do those through mail. Like, I'm not selfish. I don't want everyone's business. That doesn't make any sense. Keep doing those walk-up window and getting them same day. But if you have people that are on blood pressure medicines, cholesterols, whatever the case is, that they're doing maintenance medications for 30, 90-day fills, and you're referring those out, those are dollars you could keep in-house. Most of the doctors light up right away because they know that that's primarily what they're writing for, and they also know that they're sending it right down the road, and they could be keeping those in-house, A, saving their patient money, and B, creating a new small revenue stream back to their practice for doing nothing really. Because it's as easy as just prescribing to GoGoMeds within their EMR system, and then what we do is we take their NPI number, which is their unique identifier, and link it to the prescription of the patient, and that's how we record it to their program. As far as the patient experience goes, it's easy because, A, the doctor just asks you if it's something that you're interested in. The answer becomes yes or no. It's just like if you were to walk in and say, hey, where would you like me to send your script to? And they tell you about the new program. Okay, we'll send it to, I want to fill it with you guys. Great. If not, they send it to Walgreens. But for them, It's just going back to the website, clicking the link for pharmacy, making a profile, and there's your product. Or if you have some that are already with CVS, Walgreens, a local pharmacy, and you want to price shop it right there on the computer, you can, and then you can just hit the submit, and it'll prompt your provider to either write a new script or us to reach out and do a pharmacy transfer. So it's a pretty easy process, actually.
Yeah, it sounds super easy.
Yeah.
How long have you guys been around?
GoGoMeds have been around since 2016.
Okay.
And again, that kind of all built in the telemedicine space. So we've been building on that back end and buying these generic products to, service those telemedicine clients, digital health, whatever you want to call them. Everyone calls them something different. And then we've expanded verticals since then. So right now, the heavy focus is on the employer groups, and then also DPC. But obviously our bread and butter and something that we built a big name in is that telemedicine space.
And so you touched on like hims and hers, and I think about the GLP-1s. Yeah. Is that a big piece of your business?
It was for a while. Yeah, we own a compounding pharmacy as well, so semaglutide. I got sick of hearing it every day, quite honestly. But yeah.
He's like, get to the gym.
That, or it's just like everyone and their brother had a new, new startup that they were going to do. But yeah, GLP-1s are still something that we engage in. We can still provide them at brand as well. But when you have services like Novo Direct or Lilly Direct, it's just going to be cheaper to go through them by design, obviously. But it has been a part of our business for the last couple of years. Now that's trickling out with all the FDA rulings on, semaglutide and everything that's tied up, in the courts right now. But starting to fade a little bit.
Gotcha. And so you iterated, is what I'm hearing. Like that was it was a core component of your business. It's still there.
It's still
but
there.
It's not.
Yeah.
It's not as much a focus.
We knew we wanted to make money while we could, but we also knew that we wanted to build our business on something more solid.
Yeah.
Right.
Yeah.
We know that employer groups, like there's always going to be employer groups. There's always going to be people on these generic medications, and when we have a solution that we can actually help people, these direct primary cares, that's going to keep expanding. Like those are ones that are going to be around. The GLP ones, we always knew Big Pharma was going to take that back. It was just a kind of a matter of time and when.
Yeah.
So we joined the trend, and we were able to jump in with semaglutide during those times. But all the while we were saying, okay, let's make a sustainable business behind this. As we ride this wave.
So the DPC is one vertical.
Yep.
Another vertical are self-funded employers, I'd imagine.
Yeah, absolutely.
And I think that's the primary thrust and focus of Ascend, right? The folks that are here are primarily brokers that are looking for a competitive advantage.
Yeah.
They're frankly sick and tired of the status quo and the system, and bringing their clients the same bad news year after year. Yeah, so tell me, Trace, how do you engage employer groups? If you're focused on the self-funded world, are you dealing primarily with TPAs, or is it more brokers?
Yeah.
And what's the pitch to a broker?
So it's both. We work with TPAs and brokers. Most of the time it's TPA through a broker for administration of the actual plan itself. The way that we engage is really a lot of cold outreach until I start to work with people, and then they refer more and more groups back. There's a guy who's probably going to end up watching this, Sims Tillerson, but I do a lot of social media connections and send little direct video messages to people to kind of get to connect and link up that way. But really what we're doing is pretty simple. It's, hey, what are your groups doing in the self-funded arrangement? Can you get me a claims file, and then just let me show what GoGoMeds can do for you? There's a solution for everything with specialty right now, but what we're doing is looking at those generics, and what I'll do is, with my team, we'll take that file, do apples-to-apples comparison, and say, here's what's being spent on generics, here's what we could offer you at a cost-plus rate. Most of the time, it's 30 to 60% savings. That's a relative to a group, but for an example, I have an 80-life group, small fabrication shop in North Carolina, that's going to save, they're on pace to save about $36,000 this year. 80 life group, small, employer like that, 36 grand back in their pocket's a big deal.
Sure.
Then we have a 1,500 life group that we're, implementing this, and it's going to be over $100,000 in saving on generic medications, right? Something that people didn't know could be cheaper than they already were.
Right.
So at the end of the day is what we're trying to do is say, hey, here's a gap, because everyone's been so hyper-focused on specialty products for good reason, right? I mean, I get it. It's 80% of his plan spend. But most employees are on a generic drug. So most of the time something is getting filled as generic and it's getting overlooked because, it's just a gap. It's fine. It's an opportunity. So I like to call it.
Yeah.
And then what we'll do is we'll turn around and save it and just make it easy. We're a pharmacy at the end of the day. So again, I can plug into a PBM if they'll let me. And if not, we can go outside of that, make it $0 to the employee. So they, now the company has a retention, recruitment, employee satisfaction tool. And yeah, just try to go from there.
Are you doing any clinical service on the back end as well, or is it strictly the delivery component? Are you looking at whether a medication is appropriately prescribed or not so much?
It goes through all of the stages, right? So when pharmacy, it'll be PV'd 1 all the way through a double, pharmacist checks, especially for controls, because we do controls as well. So, it's every step of the way. So if there's any intervention that needs to happen, if patients need access to a pharmacist, we have pharmacists on staff for that. So we're trying to provide the full pharmacy service to them. We don't stop it at just getting the medication out the door and saving people money. We try to make it feel as homely as possible, or like a local pharmacy to them. So we try to white label the entire service to say, hey, we get it. It's mail order. It's a little bit new, but we're still here for you when you need us.
And so as far as a broker is concerned, or baking this into fixed administrative costs when it comes to a plan, are you a fixed administrative cost, or is it's part of claims?
Yeah.
And how exactly do the mechanics work on the back end?
So what I like to tell people too is the cool thing about us is most solutions that you see at the end of the day is if people aren't going to use them, it's going to end up costing the company more money because it's per member per month, or startup fees, or everything. We're risk-free in that scenario.
Right.
Like I don't charge a per member per month or a startup fee. It's really us just saying, here's what pharmacy should be. You use us, you save money, and if not, you know what you're paying through your plan.
Right.
So at the end of the day, I like to tell people, well, why wouldn't you?
Right.
Like if I can make it that easy, why wouldn't you give these people the option and then, save some money?
Sure.
So as far as baking it in, it's really just baked in savings at the end of the day. There's no additional risk in them paying more for something.
So for a broker, is it really just a matter of plugging your solution into the mix?
Yeah.
And is it plug and play? Is it as simple as that?
It's plug and play. We can go on cycle. So if they want to start at the beginning of a plan year, that's great. If not, I know we're coming into Q4 now. If someone kicked me a file tomorrow and wanted to say, could you get live by Q4? Then what we'll do is prorate savings and say, hey, here's what they're probably going to save in these last 3 months of the year, and then we'll gear up everyone to hopefully have even more enrollment for the beginning of the next year. So we're just, again, pharmacy at the end of the day, so we can go at whatever schedule or whatever pace they want to go.
Very cool.
Yeah.
Very cool. All right, man. Listen, I appreciate you coming out. How do people find you?
You can find me on LinkedIn. So
Okay.
You can find me on LinkedIn, Trace Voshell, our company, GoGoMeds. Start following us there. We're doing some pretty cool stuff. This podcast, when you release it, they can hopefully listen to that and get with me. But again, I think I told you on the phone is no risk to the employer, but also no risk to the broker. You guys send me 5, 6, 7 files. If it's a good fit, it's a good fit. If not, there's no hook to you. There's no responsibility to me. We just want to show people what we can do and be part of a solution here in the space. And then for you, the only thing I would request is that next time we're at a conference together, you're hit a CrossFit workout with me.
There's still time. You doing
There's
one
still
tomorrow?
time. I'll be there tomorrow, man. I'll be there tomorrow.
You may see me tomorrow.
Okay. All right.
Maybe. So Voshell. So Trace, Trace,
Yep.
Voshell,
Voshell, Voshell.
just the way it sounds.
That's it, Voshell.
So reach out on LinkedIn.
Yep.
Look this dude up. He's authentic. He strikes me as the real deal. Give him a shot.
Yeah, thanks, guys. Appreciate it.
All right, man.
Thanks, Ray.
Thank you.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.